Hello, and welcome to this video explaining an exciting new service which refers patients directly into community pharmacies. This is known as the NHS Community Pharmacist Consultation Service, or NHS CPCS. This video is specifically for those working within NHS 111 and will explain more about the service. So, what is the new NHS Community Pharmacist Consultation Service? NHS CPCS will launch in October 2019, with NHS 111 making referrals to community pharmacies for minor illness and urgent medicine supply. This new service will replace the current national NUMSAS pilot and local trials of DMERS. NHS CPCS will relieve pressure on the wider NHS by connecting patients with community pharmacy, which can deliver a swift, convenient and effective service to meet their needs. We want you to understand how the service works, so that you feel confident in referring patients into it. Initially, only patients contacting NHS 111 will be eligible for referral to NHS CPCS, with referrals from other parts of the NHS to follow and currently being piloted. Participating pharmacies have a private consultation room where patients can discuss issues in confidence with a pharmacist. There are two strands to the service: urgent medicine supply and minor illness. An urgent medicine supply is where a pharmacist provides a medicine in an emergency without a prescription to a patient who has been prescribed this medicine previously on a regular basis. NHS CPCS pharmacists can also deliver clinical advice for a range of minor illnesses, such as coughs, colds, sore throat, abdominal pain, aches and pains, red eyes, athlete's foot, mouth ulcers, constipation, and diarrhea. Their support may also include recommending and supplying an over-the-counter medicine. Most people live within easy reach of a pharmacy, and with many open in the evenings and at weekends, NHS CPCS will offer patients increased access and choice for the treatment of minor illness or for urgent supply of medicines. NHS CPCS will be known by different service names on the directory of services to reflect the separate strands of the service. For the urgent medicine strand of the service, pharmacies providing NHS CPCS carry the DOS service name Pharm+ to signify that they supply urgent repeat medicine as well as their standard pharmacy provision. The urgent medicine strand is available to patients of all ages. The minor illness strand of the service is known by the DOS service names CPCS and CPCS+, with CPCS referring to the standard minor illness provision with a 24-hour or longer referral time frame, and CPCS+ referring to the enhanced minor illness provision with a 12-hour referral time frame. The minor illness strand of NHS CPCS is available to patients of 1 year and older. Following an assessment using NHS pathways, a patient should be referred on to an NHS CPCS pharmacy where one is presented at the top of the DOS list. Remember that these DOS entries can be identified by the service names that start with Pharm+, CPCS and CPCS+. You should always offer the service at the top of the list first, then only move down the list of services presented if patient choice indicates another preference. Be aware that some areas may continue with local pharmacy schemes as well as NHS CPCS. Please speak to your NHS 111 supervisor for guidance if required. Please make sure you read the service referral instructions listed on the DOS entry. Advise the patient to attend the pharmacy for a consultation with a pharmacist. Provide the address and telephone number of the selected pharmacy. Explain that the pharmacist will be expecting them today, or in the case of a pharmacy that is currently closed, when the pharmacy is next open. The patient should let the pharmacist know that NHS 111 has sent them. If the patient is requesting an urgent repeat medicine supply, you should suggest that they phone the pharmacy before they go. please do not actively promote the urgent medicine supply strand of the service. It should not be used as a replacement for the normal repeat prescription ordering and repeat dispensing processes. When you select a CPCS, CPCS Plus or Pharm Plus entry on DOS, a referral is sent directly into the pharmacy clinical IT system, in the same way that you would send referrals to GP services. When at the pharmacy, the pharmacist conducts a face-to-face consultation using a structured approach and the patient's summary care record, which holds important information about current medication, allergies, and details of any previous bad reactions to medicines. If the patient needs to be referred on to a more urgent care setting, the pharmacist can arrange this. An electronic message is then sent to the patient's GP with a summary of the consultation. Patients who access the service with a minor illness will be provided with verbal advice and printed information relevant to their condition if required. This includes self-care messages, expected symptoms, the probable duration of symptoms, and when and where to go for further advice or treatment if needed. Patients requesting urgent medicine supply will be advised on the importance of ordering prescriptions in a timely manner from their GP practice and the benefits of electronic repeat dispensing. Effort is made to ensure the patient understands the advice provided or is referred onwards if necessary. NHS CPCS will be monitored to continually improve the service. This will include information captured from NHS 111, such as when NHS CPCS is selected or rejected on DOS. You can provide feedback to your NHS 111 supervisor on how NHS CPCS presents in the list of DOS services. This will ensure that appropriate action can be taken to make improvements where needed and encourage a high-quality service. You can find further information about NHS CPCS online. Just search NHS CPCS. If you have any further questions, please speak to your NHS 111 supervisor. So that's NHS CPCS. 1 service, 2 strands, 3 service names on DOS, and for patients, a private consultation on the same day without an appointment with an experienced healthcare professional. Thank you very much for watching this video and for your work to support community pharmacy playing an integral role in the NHS urgent care system.